Good afternoon, everyone. We're going to give it about 30 more seconds while people sign on, and then we'll get the webinar started. All right. Hello, everyone, and welcome to part 2 of Using County Health Rankings and Roadmaps to Support Health in South Carolina. I am Hannah Walters. I'm with Eat Smart Move More, South Carolina, and I'm joined again by my co-host for this webinar, Dr. Megan Weiss, with the South Carolina Institute of Medicine and Public Health. Today, we are pleased to be joined and to partner once again with County Health Rankings and Roadmaps to present part 2 of a 2-part webinar series designed to give us an overview of how we can use county health rankings and roadmaps to support health here in South Carolina. In part 1 of the webinar series, we focused on the rankings component of county health rankings and roadmaps. And if you didn't have a chance to join us for that webinar, that recording is available on Eat Smart Move More's website, and I can share that link with everyone later. So for today's portion of the webinar series, we are going to explore roadmaps to action, where you will learn more about the tools and resources available from county health rankings and roadmaps to support you in improving your community's health. Before we get started, I'd like to go over a couple housekeeping items. If at any point throughout the webinar you have questions, please type them into the question box, which is located in your webinar panel, and we'll have time to address those questions at the end of the webinar. And we will also periodically share links and resources in the chat box, so keep an eye out for those. Also, if you have technical difficulties, you can type those into the question box, and we'll do our best to help resolve those throughout the webinar. And then finally, and very importantly, the webinar is being recorded, and we will share the link with you all after the webinar. All right. So if you joined us for last week's webinar, you already heard this spiel, but I'm going to give a quick overview of Eat Smart Move More South Carolina and then pass it over to Megan to talk a little bit about the South Carolina Institute of Medicine and Public Health. But if you're not familiar with Eat Smart Move More, we are a statewide nonprofit. We work to advance community-led change to reduce obesity in South Carolina by making the healthy choice the easy choice. We do have 3 strategic focus areas: advocacy, community action, and youth engagement. And much of our work focuses on partnerships. We have 22 local Eat Smart Move More chapters that are working to create sustainable change in their local communities around healthy eating, active living. And I invite you to visit our website, eatsmartmovemoresc.org, to learn more. All right, and at this point, I'm happy to introduce Megan Weiss with the South Carolina Institute of Medicine and Public Health.
Thank you, Hannah. Just to share a little bit of information about the Institute, for those of you who did not or who weren't able to join us last week, we're an independent entity, and we serve as an informed, neutral convener around the important health issues in our state. We also serve as the provider of evidence-based information to inform health policy decisions. And the way we work to achieve this mission is through convening academic, governmental, organizational, and community-based stakeholders around the issues that are important to health and well-being of all South Carolinians. So as we do this work, we do take a comprehensive approach to advancing health issues through data analysis and translation, and also collaborative engagement. So please visit our website at www.imph.org to learn more, including about our work with the County Health Rankings and Roadmaps, Behavioral Health, Long-Term Care, Obesity Prevention, and the Health Policy Fellows Program. And just as we did last week, we know many of you are very social on social media, so I invite you to engage with us online both during today's event and after today's webinar. On the screen, you can see the Twitter handles for both Eat Smart Move More South Carolina and IMPH. And also, I'll ask you to use the hashtag for County Health Rankings and Roadmaps. It's hashtag Health Rankings, and also hashtag Healthier South Carolina, or Healthier SC, is the one that's being used by many organizations around the state to have health and public health conversations on social media and all topics. I also would like to ask you to please save the date for Population Health Summit, which is scheduled for May 20th, and it's partially supported by funding from the County Health Rankings and Roadmaps, and I believe one of our speakers, Erica, will be participating in this meeting as well. It will be a multi-site summit in both Low Country, Walterboro area, Florence, and the upstate, and also in Columbia. And as registration information is available, I will definitely be posting that on the IMPH website. Last week, we shared an image of a sweetgrass basket being made, and we talked about how South Carolina has a rich culture to draw upon, and all communities can continue to respect their heritage as they come together. The weaving of the individual strands of grass visually represent the power of collaboration to bring diverse partners together to create something new. Partnership, with working with the diverse partners for all walks of life, is one of the ways different communities in South Carolina are building this culture of health. So today we are sharing an image of a completed basket. So during today's webinar, please think about how the County Health Rankings and Roadmaps can help you and your community weave your vision. What will your basket look like? So I'm very pleased to welcome back two community coaches from County Health Rankings and Roadmaps, Jan O'Neill and Erica Burrows-Girardi. Jan is located in Madison, Wisconsin, and Erica is located in Orange City, Florida. As community coaches, Jan and Erica guide cross-sector partnerships across the United States in building a culture of health in their community. Jan and Erica, welcome to the webinar.
Thank you, Megan.
Thank you, Megan. This is Jan. Great to be here again. Thanks.
And we'll hear more from Jan in a second. This is Erica. And I too would like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. This program is a result of contributions of many partners that we work with, including those listed here, and we appreciate their contributions. We invite you to consider, as you leave this webinar, who else do you think that you need to share this information with? And what is one idea for action that you will be taking from this webinar? Here you see a picture of the thinking behind the rankings, and it's our theory for change about how rankings can be a catalyst for action that improves the health of everyone in a community. Every year the rankings release in the spring generates lots of media attention. In fact, last week the 2016 rankings were released. And if you haven't already, I encourage you to visit www.countyhealthrankings.org following today's webinar to see where your county ranked this year. The media attention provides opportunity for people to tell the story of the many factors affecting health in their community. And they use these findings as an opportunity to mobilize multiple sectors to look further at their community strengths and needs. And based on this deeper look at their unique priorities, community members identify evidence-informed strategies that can be implemented locally to make change. Over time, these evidence-informed strategies ultimately result in longer, higher quality of lives for all of the children and adults in the community. So in essence, the rankings are a call to action to encourage people to move from awareness to action and improving health in their community. Now today we're going to spend time fleshing out the vertical part of this model. So we will focus on the ways to access tools and resources to support communities taking action, including garnering that broad community engagement and using evidence-informed strategies to improve health outcomes. Today we're focusing on that Roadmaps piece of the County Health Rankings and Roadmaps program. Roadmaps offer communities resources to move from awareness to action. Excuse me. This image is key to Roadmaps. In a second, Jan will walk us through it. But there are 4 important foundations of Roadmaps that I would like for you to remember. First, it takes everyone, all of us, working together to improve the health of a community. We need to move as quickly as possible from data to action, not get stuck in analysis paralysis or drowning in the data. And we encourage communities to look at evidence to inform these actions. And if you innovate, be sure to evaluate the work that you do. Keep focused across the health factors, including those social and economic factors that so much influence our health. And don't be afraid to take on policy, systems, and environmental change, which will, in the long run, create the greatest long-term change in health for the children and adults in your community. Now, before we launch into a discussion about roadmaps of Jan, we would like to know how much you know about roadmaps. So Hannah's going to launch a poll that we're going to ask you to complete.
All right, so everyone should be seeing the poll now. We'll give you another 20 seconds or so to complete the poll. All right, great. I'm going to close it up and show the results.
Okay, thanks, Hannah. So we see that there are a good bit of you who actually know about the poll, know about the roadmaps, but at least a quarter of today's attendants are like, huh? What are the roadmaps? So I think this next section, this next part of the webinar will be really informative for you. And for those of you that are familiar with the roadmaps, I would invite you to actually pay really close attention, because we often find that a lot of people are not even, or surprised by the depth of the information that they can find about roadmaps. So with that, I am going to transfer it over to Jan, so Jan can take you on a tour of roadmaps.
Great, thank you, Erica. So what you should be seeing is the countyhealthrankings.org site, and we were here in the first webinar. I'm going to take us back in. We spent in the first webinar some time on the health rankings side, and what I'm going to do is take us back to the navigation bar to the roadmap side, and we're going to take a look at the Action Center specifically. But you can see when I click on the roadmaps to health, little navigation bar, you'll also see roadmaps to health coaching, so you can learn more about our coaching program and you can apply for that. We'll talk about that more in a bit. And I'll also be taking you into what works for health. You can also see that we have stories from many, many different states, and so that's a great place to find examples, as well as a projects showcase which shows what different folks are doing with the things and with the roadmaps in different parts of the country. And then you can also see our national partners. So I'm going to take you into the Action Center now, and I want to be sure that you all can see my screen, and so I'm going to just check with Erica, make sure that it's at the right font size. Does that look okay, Erica?
Jan, we can see a screen. If you can increase the font just a tad bit, that would be helpful.
All right, how's that?
That's better, thank you.
All right. So as you can see, here's our Action Center, and we call this our Action Cycle. And in the Action Center, you will see guidance for each of the steps in the Action Cycle. You can find that guidance either over here on the left, or you can see it in the Action Cycle itself. So for example, and you'll see it's interactive, when I run my cursor over Assess Needs and Resources, it tells you what that guidance is about, and that's true for every step. You'll also see we have two quote steps. They're not really steps, they're really what happens all the time throughout improving a community, which is work together and communicate, and those sit outside of the actual steps. Now this makes it look like it's very linear. Oh, we go from assess right to focus, right to choose, but we know that there's a lot of back and forth throughout these steps. I also want to mention that we also have guides for all of the community partners involved in making improvement. And these partner guides you can also find over here on the left. So what I'm going to do is take us into Work Together, the guide, and show you what that looks like. Erica, let me check the font size again. How is that?
That's good. It'd be nice if you could enlarge it a tad bit. That would be helpful.
I need to keep checking so we don't make people seasick as I scroll through this. So what you'll find here is a brief description of what this guide is all about and who to involve. And then you'll see that we've broken the steps down into key activities. And in Work Together, there are 9 key activities. And these are where you'll find the most relevant guidance and tools for where you are. So when you find an activity of interest, you can open it up and read about the guidance and explore the links there. This year, I just wanted to point out, we did add a new key activity, Work Together to Address Health Inequities. So you may want to take a peek at that. I'm going to be taking us deeper into recruit diverse stakeholders from multiple sectors because this is an ongoing process. It's not just something that we do once. And I'll show you what a key activity looks like. As you'll see, here's the guidance, and then you'll see suggested tools on the right-hand side. And these, you'll always see up to 5 tools. And if there are more than 5 tools, you can click here and see what the other tools might be. But if you want to see just the top 5 that we know are sort of go-to tools for communities that we coach, well, those are the top 5 tools you'll see there. You'll also see in some of the key activities, communities in action stories. That's what this is right here. They're scattered throughout the Action Center and they're in What Works for Health. And they provide examples of programs, policies, and tools in action. This one from United Way of Greater Toledo explains how they use 3 of the tools that are included in this key activity, and Hannah is going to be sending you the link for these tools in recruiting coalition members. So I'm going to click on this community in action so that you can see they're very brief and they talk about the tools specifically that they've used and how they've used them, and then we always have a link to their website and how to get in touch with them. So I'm going to go back, and before I go all the way back, I want to mention that throughout our site you'll see these Get Help buttons, and this invites you to contact our team for personalized free help. Thanks to the Robert Wood Johnson Foundation, all of our coaching assistance is available at no cost to anyone who wants to get in touch with us. So clicking on Get Help can take you to an email form that gets to one of our 10 community coaches who are based around the United States, and we'll talk more about that later in the webinar. So I'm going to back to the Action Center, and actually you can get to where I'm going next anytime you go up to the navigation bar, but I am going to go back to the Action Center and just show you on the navigation bar that there's another way to get to tools, and that is when you click on Resources, you can go to Tools and Resources, and that will bring you to all of our tools and resources. And you see on the left here, we list the types of tools and resources. And I just want to mention that there's 2 presentations you can download. One of them is an overview of this whole website and the whole program, in fact. And you can download that, you can customize it. I think Meg's done that in the past. We've used that. We've actually used it for this webinar, so that's a helpful tool to know about, along with all these others. So we want to show you, for example, how to get to the tools. If you want to do a search, and let's say I wanted to search for equity. So we get 8 results, and I want to just go in and take a look specifically at this toolkit. And this happens to be listed also in the new equity key activity. And this is Action Toolkit from the makers of Unnatural Causes. So you'll always get a description. It will also tell you the other places that you can find that tool. So if I click on it here, it'll take me directly to their site, and then you can play around on their site. So I'm going to go back, and next what we're going to do, actually let me just pause here and see if there, if you can still see everything, Erica, if it's still clear.
It's you know, it's a little challenging with the, but that's okay. We know that you're mainly showing us how to navigate through the website.
Correct. Thank you. Yep, thanks for saying that. We hope that you can use this webinar and the archived version of it to remember how to navigate through it, but also I wanted to mention that we do have a webinar coming up, County Health Rankings 101. I believe that's on April 5th, and we'll take you in a live, more in-depth tour of the website. You can actually ask questions during that time as well. Thank you. So let me go back up here, and let's go back to what works for health. Let's go into what works for health. So we know that a question that every community faces when they're taking action is, well, what action do we take? We've got the data, now what? What intervention, what policy or program is going to be effective? And we actually have a whole step in the Take Action cycle that's dedicated to that, and it's called Choose effective policies and programs. And in that step, we have this tool, What Works for Health, and you can also get to What Works for Health through the navigation bar as I did. So on the right in What Works for Health, you'll see we always list our new or updated policies and programs, and on the left you can learn about our ratings and our methods, and you can also look at the 4-minute tutorial, which we'd highly recommend. It's a great way to learn how to explore what works for health. So What Works for Health is a resource of over 300 strategies that our team here at the university is constantly reviewing and adding to, and we rate these strategies for strength of evidence. So to learn more about strategies that could work in your community, you can select a health factor of interest. So here's the health factors. This will look familiar. Or you can enter a keyword in the keyword search box. So let's just take a look at one. On the rankings framework here, let's take a look at the types of policies and programs we might find under diet and exercise, because that's the focus of your partnership and your coalitions. So here we find 73 results. And you can see that they are online here according to alphabetically organized, but you can also look over here on the left and see how they fit under social and economic factors, physical environment. So there's one education policy or program that fits under a social and economic factor, and 2 that would address family and social support. There are 7 that would address housing and transit. Another thing to know about is it's helpful to know what your goal is. So if you know, for example, you have a goal for increasing access to healthy food options, you know that we have 26 strategies that fit under that approach. You can also filter by decision makers, and so you can go in by either your sector or perhaps by another sector in your community and see which strategies they would be involved with specifically. Or you can look by evidence rating. And evidence can mean different things to different people. Our approach to assessing evidence combines what we know from the science and from observations of unbiased experts. Each reviewed strategy is assigned a rating based on the quantity, quality, and findings of relevant research. And you'll find more about these ratings and what they mean under the Our Ratings tab that I mentioned before. Also, you can find it when you go into a specific strategy. So let's just imagine we're a community partnership that's focusing on childhood obesity. And with us in our partnership are educators and parents, some nonprofits who are specializing in healthy foods, along with public health folks and healthcare practitioners. And our goal is to provide healthier food options for kids, so we could narrow our search by approach. And as I mentioned before, we see that there are 26 strategies that are listed for that. And we also, so I'm going to filter for that That's still a lot. So we also want to, because we don't have a lot of money for evaluation, we decide that we would like to look at the strategies that meet the highest standard, which is scientifically supported. And we see that there are 2 such strategies. So I'm going to click on those. And we'll see that now we're narrowed down to school breakfast programs and school fruit and vegetable gardens. So we have a little conversation and we decide, well, you know, we've already got a pretty good school breakfast programs going in our district. Maybe what we should do is take a look at school gardens. So let's look at what we've got here. And we see the full entry here. It tells us what the strategy is about. It tells us which benefits have been rated. So increased willingness to try fruits and vegetables and increased consumption, but there may be other beneficial outcomes, other things that perhaps didn't show up in the science that we've taken a look at. And it could, these could have some, this strategy could have other positive impacts. So continuing to scroll down, excuse me, we see, here's the evidence. We also see whether we have been able to see impact on disparities. And at the very bottom, and this, by the way, I want to say, if this approach or this strategy is adopted in a community that's like the communities that were researched, then there will be an impact on disparities. But if it's in a different kind of community, you might see a different impact. So I just want to mention that. It's always good to keep that in mind. There are implementation examples, there's implementation resources, the citation about the evidence, and also implementation examples. We could open those up. We always list when it's last updated, so December of 2015. And it's also good to look down here at the related policies and programs, because perhaps we've looked through all of this and said, oh, you know, this really isn't a good fit for us at this time. Maybe we've done some more work in the choose effective policies and programs step of the action cycle. There's some tools there for having conversations about the strategies. And we said, well, you know, it just doesn't fit us. Let's find a related policy or program to take a look at. And I'm going to scroll back up and notice that for this particular strategy there is a community in action, which highlights how a particular school used this strategy. And this is in Harrison, Michigan. I actually know this school from a previous life and from this coaching that I'm doing at the university. And this is a wonderful story about what they did to create a school garden where the kids are very involved in bringing the garden goods to the school table. And you can find out more at Together We Can, which is in Central Michigan. And so you'll find these spotlights sprinkled throughout What Works for Health and also in the Action Center. So now I'd like to transition back to Erica. And Erica, I'm going to make you presenter again and take us to the next part of our webinar.
Thank you, Jan, and thank you for that wonderful tour of the Action Center.
Erica, we can't hear you.
Okay, I'm sorry. I thought I had unmuted myself and I did not. So thank you, Jan, I appreciate that. Thank you for that wonderful tour of the Action Center and telling us about how folks can look into what strategies might work for their community through our What Works for Health database. So in addition to looking at the evidence for effectiveness, there are other factors that you would want to consider when you're choosing a strategy that would work for your community. For instance, community fit, readiness, priorities, the capacity, and resources. Those were equally important. So now I want to transfer to Meg and Hannah, because they're going to share with you about some things going right there in South Carolina that you might be interested in learning about.
Thank you very much. First, this is Megan, and I'd like to share some of the examples, non-obesity related. I know Hannah will share a little bit more about Eat Smart, Move More's work, but there are, just for example, 3 programs that can be found in What Works for Health that are being implemented here in communities. One is the Nurse Family Partnership. Many of you may be familiar with this. It's an evidence-based initiative that pairs nurses with new mothers to provide more than just medical care, and it's being expanded across South Carolina. In this program, nurses meet regularly with the mothers and also provide them with support and resources to strengthen their parenting, lifestyle, and financial choices. And this also includes referrals for nutrition, physical activity, birth control, financial planning, and stress management. Last month, Governor Haley announced a $30 million expansion of this program, which is supported by DHHS through Medicaid funding and also through the Duke Endowment. Also, when we take a look at other types of policies that can impact an environment, 29 South Carolina colleges and universities are tobacco-free due to enacting tobacco-free policies, and 39% of the state citizens are also now protected by comprehensive smoke-free workplace laws. And then a final example is the Medical University of South Carolina, which supports telemedicine, sometimes called telehealth, to use telecommunications technology to deliver patient group education through telemedicine or telehealth in partnership with primary care providers, particularly in rural areas of the state. And this includes Bamberg, Kingstree, Seneca, Prosperity, and Barnville. Hannah?
All right, this is Hannah. So I know many of you are already familiar with Eat Smart, Move More, South Carolina, but for those of you who aren't or who aren't necessarily working every day in healthy eating, active living environments, I did want to share a few resources that we provide. As I mentioned earlier, our work falls into 3 key focus areas: advocacy, community action, and youth engagement. So if you're interested in one of those specific areas, I do invite you to visit our website to learn more about each of those areas and how you can get involved specifically with one of those. One resource to be aware of on our website, I have a photo here of it, is our Options for Action database. If you click on a setting, and so this isn't interactive at the moment, but you can see there are the 6 settings here: child care, community, etc. If you click on one of those settings, you'll find dozens of resources like toolkits, templates, talking points, many other things, all related to creating sustainable changes around healthy eating. And what's great about these resources is that many of them are specific to South Carolina, so they were toolkits created with South Carolina in mind, or they were implemented in South Carolina, which is why we chose them to go on the database. So it's a great landing page for a ton of resources that can help in your work. I also wanted to talk a little bit about our HYPE program, the Healthy Youth Empowerment Program, or excuse me, Healthy Young People Empowerment Project. And this is in partnership, we created it with South Carolina DHEC and the Arnold School of Public Health. And the HYPE project really motivates youth to, throughout South Carolina, to engage in policy systems and environmental change efforts related to healthy eating, active living. And this program has been going on since 2012, and we've had about 32 HYPE teams throughout the state. So you can check out our website to learn more, and if you're interested in creating a HYPE team or getting involved with a HYPE team in your community, let us know. We would love to work with you. And then finally, I want to point you to our letsgosc.org website. And this is a more consumer-focused website. It features an interactive map where you can put in your zip code and it brings up nearby farmers markets, trails, parks, and other healthy, affordable resources. And there's also a Healthy Eating, Active Living blog component, which features various experts from around the state. So I definitely encourage you all to take some time to explore these resources. And if you have any questions, all of the staff contacts are on our website, and we would love to work with you.
And also, I want to remind you all about our coaching. This is Erica. And coaching is part of our County Health Rankings and Roadmaps, and you can obtain guidance for moving forward in your community in terms of your community health improvement work, especially if you want to use our tools and resources. Coaching might be actually something that would be helpful for you. So how do you apply for coaching? How can you access coaching? Well, Jan told you about those Get Help buttons that are peppered throughout our website. You simply just need to click on one of those, and you can include your information, just maybe 1 to 2 sentences about your work that you're doing in your community, and a coach will be in touch with you, usually within 48 business hours. So I encourage you to take advantage of it. You'll notice 2 very important adjectives in that Get Help box, and that's personalized and free. So know that we're here to help support you in your community health improvement efforts. And Meg has probably already shared some information about coaching with you in our handouts box. So Meg, do we have some time for questions?
Yes, we do. For anyone, if you have any questions, please feel free to type them either in the chat box or in the question area. I am monitoring that. While we wait for some questions to come in, both for Jan, Erica, and you, Hannah, I was wondering if you could talk a little bit more about how someone could find out if their county has a Eat Smart Move More coalition or a group already working in this area, and if not, what should people do?
Sure. The easiest way to do it is to go on our Eat Smart Move More website, eatsmartmovemoresc.org, and you can find out there if your county has an Eat Smart Move More chapter, or if not a specific chapter, they may have another nonprofit or coalition that is working working around healthy eating, active living. So that would be a place to start. If there isn't a coalition actively that you can see in your community, then there's a place to reach out to us, and we can work with you on seeing if it makes sense to start an Eat Smart Move More chapter in your community. And really the key starting point to do that is to bring the right people to the table. So find out who is working around healthy eating, active living, who are the key partners who you should have at the table, and kind of get them together at the same table and start a discussion. But we would be happy to work with you to kind of go through those steps if you want to check out the website and go from there.
And Megan, this is Jan. I'll just jump in too to build on what Hannah said to complement that. You'll recall in the Action Center, we just saw the Work Together guide and we went into Recruit. And so there's some really great tools in there, and I'd encourage you to take a look. It's we get this question a lot about, there's nobody that seems to be working in this space. How do I gather people together? Who should I be talking to? And there's a particular tool called Build a Contact List that I believe is in the Recruit key activity, and that is really a good one for thinking with others about who should we sort of bring together around our shared passion here. So that's complementary, I hope, to what Hannah said.
Okay, wonderful. Thank you both. Also, another question is, what does a coaching process look like? I know you talked about that there's coaching available and how to get in contact, but what does that really mean in terms of working with the community?
And Meg, this is Erica. I'll be happy to take that question. Coaching is a process. It's almost like a partnership between your coach and a team of people from your local partnership. And coaches work alongside their teams to help them explore solutions to challenges that they may be encountering. Sometimes they're encountering challenges such as what Jan was describing, like not really knowing who to bring to the table, or they know certain groups or populations need to be involved in the discussion of improving community health, but they're really not quite sure how to reach out to those folks. So coaches can help community groups explore their options and help them develop a strategy for doing that. In terms of the actual work that happens between a coach and a community team, again, is usually a team of about 5 people that may be coming from a partnership that will meet with their coach once a month. And due to the support of the Robert Wood Johnson Foundation, we are able to meet with community groups for up to a year. I mean, not all community groups need to meet for a whole year, but if they do, we are there to help them. And we will meet with them once a month, usually through conference calls or video conferencing. We will share suggested strategies and tools from our website. We can also connect them to other groups around the country that may be exploring similar strategies, maybe looking for solutions for similar challenges. So we like to network our community groups with those around the country. As an example, I'm working with a team in Indianapolis, and it's a food policy council, and a colleague of Jan and mine, another community coach, is working with a team in Joplin, Missouri, also a food policy council. Well, those two food policy councils are meeting next week to talk about some of the work that they've done and kind of exchange ideas, and we love doing stuff like that. So and again, it's a very simple process to get in touch with us. The main thing that we look for out of teams, because folks often want to know, how do we know if we're ready for coaching? So the main thing that we look for is a commitment. We want groups to be committed to this process, be committed to coming together once a month to meet with their coach, but also being committed to working outside of those meetings with their coach to get things done, and being accountable for that, and being willing to share what they are learning with the rest of their partnership. And so that's the type of commitment that we're looking for, and we're excited to be able to help groups. We've worked with over 100 communities across the United States. So check us out and use that Get Help button to get more information.
Erica, this is Jan. I just love how you describe the coaching as a partnership. It's so perfect. And I also wanted to mention that on our website under resources, folks can look at an archived webinar of the Joplin team talking about their coaching experience. So if you want to hear what it was like from the community itself, Joplin actually did a webinar with us. I think it was last year.
Yeah.
Okay, wonderful. Thank you. I do have a question that I can take. Someone asked if the slides will be available, and yes, a copy of the PDF of the slides will be sent out by Hannah later when she's able to send out the link to the video. We'll have both the video and a link to the slides available online. And I'll wait one more moment to see if there's any other questions coming in. Not at this time. If you think of a question, let me know. But in the meantime, I'll pass it back to Erica and Hannah to wrap us up this afternoon.
Thank you, Meg. So yeah, as we begin to wrap up, and as you move forward in your own community health improvement journey, working to create a health for all, we invite you to focus on what we call the 5 Ds. Investigate the differences using the Digging Deeper tool and other data tools on our website to understand the differences between the subgroups in your community. And focus on the drivers that most influence health. Policies, systems, and environmental conditions that create opportunities to improve health for all are those drivers. Dig into the root causes. While all of the health factors affect health outcomes, be sure to focus on the social and economic factors as they contribute the most to poor health. And then determine the most effective strategies, especially those strategies that, if directed to those greatest in need, will reduce health disparities. And finally, do it. Harness the collective power of your community to take action that will create more equitable opportunities for good health for everyone in your community. Hannah?
Great. Well, I want to thank you all again for joining us for this webinar series. We hope you're inspired and empowered as you move forward in your journey to build a culture of health in your community. And I'm going to bring up a slide here that we had on the first webinar just to provide a few reflection questions. So we want you to consider, as you leave this webinar, who else do you need to share this information with? We will have links to the webinar recordings. You know how to use the website now. Who else should you share this information with? And what is one idea for action that you're taking away from this webinar? So I hope you'll take some time to think about that. And as Meg said, both webinars in the series will be posted on our website later today, so you'll have that information. And I finally want to thank Jan, Erica, and Megan for a wonderful partnership and wonderful webinar series. Our website addresses and my and Megan's email are on the screen, so please feel free to reach out to us. Also, we will be sending out a short evaluation survey after the webinar, and we would greatly appreciate your feedback. So we really want to make sure that this webinar series was useful, and we really would appreciate your feedback. And finally, thank you again for attending the webinar, and we will sign off now.